Perfect. Well, I know your guys' time is tight, so thank you for joining us.
Yes.
We're just getting ready to stream live, so I'll kick us off and we'll
Okay.
pass it to you guys here in just a minute.
Okay.
Hello, everybody. Welcome to our third week of the regional report out calls. My name is John Rolfe, and I'll be hosting these report outs. So first and foremost, if you would like to get this call sent to you with the dashboard as soon as it's over, that you can sign up at covid.ks.gov/report-outs. That's covid.ks.gov/report-outs. And then if you have questions or comments, things you want us to discuss on the next week's call, you can email us at ksregionalreport@gmail.com. That's ksregionalreport@gmail.com. Now, we'll be here every week at 2 o'clock. This is the December 29th, and this is for the Northeast region of Kansas. And so I will start by going over the dashboard, and then we'll pitch it and get public health and hospitals, and we have our special guests to hear from boots on the ground. And then we'll hear about transfer situation from Dr. Watson and the Mission Control app. So let me start by sharing the screen. Megan, if you could make me the host, and I'll pull that up. All right. She's quick on that. Here we go. All right. So if you look here, the Kansas Hospital Association puts this together for us every week. This is the one from yesterday, December 28th. And I'll make this point every week. These are static numbers in a fluid and dynamic environment. So they do change throughout the day, but we do need to pick a point in time. So as you can see, 21 hospitals in the Northeast region of the United States. Gosh, I'm going a little too fast here. Northeast region of Kansas. And that map can be seen at that website I gave you earlier if you want to see where your county or how it's divided. A third of the hospitals were anticipating staffing shortages this week. We monitor that one closely. Hospitals, when they run into issues, and Sarah helped teach me this, it's either staff, space, or stuff, and most recently has been about staff. When we come, I like to come down here and look at adult staffed ICU beds. There's 18%. Is the number this week of available beds. There's 20 beds in this region. And then I will come back. I'm going to look more into the data behind the COVID deaths. I think this is just a one-day number from the trailing day, but I want to get more information for everybody on that. And then coming and looking at the caseload and new cases, as we were saying last week, it does appear that we're seeing a plateau in this region coming off the peak in November. And of course, we all have our fingers crossed, hoping for the best as we see what happens post-Christmas and post-holiday bump. I'm going to switch over to here. I'm hoping this is pulled up. So our friends at KDHE have put this together for us in our regions. It looks like a bunch of colorful dots, but you can see what they mean down here. This is a positivity rate chart. Oh man, just cycled on me, didn't it? Well, you're going to get to see how to get there. So when you get into their stats, you go to hospital capacity section, and down in the bottom right, you'll see HCC, which is Healthcare Coalition's percent positive rate. So we are talking about Northeast Kansas, and you can see as it comes across every week here, where we're at. And so I just want to point something out. When you look at the total PCR tests, I'm back a few weeks here, but 24,000, 20,000, almost 21,000, 22,000. 21,000. This is weekly tests. You can see this last week, it was only 15,000. And that's because of the holidays and the cadence around Christmas and all that. And you can see those percent positivity, just over 10% last week. And between that 10 and 11% the last few weeks. Now we're 450 tests in this week. It's early, but we're at 21%. So we're seeing a little higher positivity rate in the first part of this week. But just want everybody to know that was out there. And then coming on down on our chart, so you can see the counties that are in this region. We pull Kansas City out. They have their own call at 1 o'clock. But you can see the percent of people have tested positive as a percent of the population in these different counties, and then get a census of the ICU beds of COVID versus non-COVID. And it's also important to point out that this time of year, generally hospitals are running near capacity with just non-COVID patients. And so, that's part of the stress that you hear and that is out there on the system with the addition of the pandemic. So there is our dashboard and a lay of the land. I'd now like to pitch it over to Derek. Am I Fleur-Lage? Is that the right way to say that, Derek?
Fleur-Log. Close enough.
Fleur-Lage. Gosh, you've said it to me before. I'll get it right next time. From Shawnee, infectious disease specialist. If you can give us a little bit from public health, that'd be great.
Sure. Yeah, I think our trends in this area of the state, I about said country too, John. So in this area of the state, we've seen improvements, and especially here in Shawnee County, just local numbers. We've seen that percent positive trending down. We've seen those cases reported weekly trending down. The important thing to remember, or maybe see when you look at the trends, is that the numbers are still very high. So when I say improvement, while true, when we compare those totals to what we were seeing, maybe earlier on in the summer, the numbers are still very high. So we're seeing 600 to 700 cases a week at the moment here in Shawnee County. Comparatively, earlier on in the summer, that was 150. We want to be below 175 for a week. We have a weekly scorecard that we release here that kind of guides decisions and helps other businesses and hospitals kind of guide decisions too, just as a metric. We use all these different metrics, and so the total case count that we like to see for a change in anything would be less than 175. So we're still very high on that. The testing capacity has obviously increased, and that's due in large part to the state's initiative, the gogettested.com/Kansas. We've got a number of sites here in Shawnee County, then across the region too, that are now open and functioning, doing the saliva PCR through Well Health. That's really allowed us to get a broader reach into our counties and get a better idea of who's positive. But that positivity rate's still very high too. So we're taking those one step at a time, and then we're also kind of preparing for this potential holiday spike too. So I think we've been lucky early on in this winter season to have some mild temperatures. Of course, today, at least here in Topeka, we're seeing some snow and ice, and so that means people are gathering indoors. Of course, we have New Year's around the corner, so really want people to stay focused. We see that light. It's getting brighter and brighter each day, each week, and we're getting closer and closer to it, but we're not there yet. So we got to hang on and keep doing what we know are the right things to do.
Thank you, Derek. I appreciate that. Well, let me pass it over to Sarah Gideon, who has a wonderful halo effect going on, like an angel on high here. Go ahead.
Hi, John. Good to see you again. My name is Sarah Gideon. I'm with the Health Innovation Network of Kansas. On a day-to-day basis, I work with 16 hospitals in Northeast Kansas. For this call, I represent 21 hospitals, so five additional hospitals to talk about today. You talked about on the dashboard a couple of things that I wanted to highlight. Our staffing has remained static as far as having 7 hospitals within our region last week and this week that were both seeing critical staffing issues. That was up a hospital from 2 weeks ago. And another thing that I thought was interesting in looking at our dashboards and comparing them back a week ago was last week, we had 27 of the adult ICU beds available in the region. The week before we had 35. This week we have 20. I say that to say that those numbers are not moving in the direction we would hope, and that is both COVID and non-COVID patients. But I also want to reiterate to people that if you need care, please seek care. Please go to your local hospital, your local clinics, your local ERs and emergency rooms and urgent cares as you need to see providers for any issues that you may have. We have seen our COVID cases remain static over the last 7 days from this time last week. But another shift that we saw was last week we had 50% of the cases in our hospitals were non-COVID patients. This week it's 41%. Last week it was 27% COVID patients. This week it's 41%. So we're starting to see that increase in hospitalized COVID patients as a percentage. And you pointed out too that we've seen that percent positivity rate starting to go back up with a smaller group. based upon the testing, but we want to keep those numbers down as much as possible. So I was listening into one of your earlier calls, and one of the quotes that I picked up from that was, "What you do today matters." The actions that we take today as individuals, as communities and counties matters. That includes those public health measures that Derek has spoken about, that I'm sure that Julia and Dr. Longwell will speak about too, and that's washing your hands, maintaining social distance, and wearing your masks. We have seen 2 of the counties within our region decide not to continue with their mask mandates after seeing declines in their week-to-week COVID numbers. So we'll have to watch and see what happens in those areas. Most of the other counties have seen an increase in the percentage of cases that they have within their counties. So we just need to remember what we do today matters. So I'd like to turn it over today to Julia Pyle. She's the Director of Nursing at Newman Regional Hospital in Emporia, which is a 25-bed facility in Lyon County. And along with her is Dr. Longwell, who is their Chief Hospitalist and Chief Medical Officer. So Julia and Dr. Longwell, thank you so much for being with us today.
Thank you for inviting us to be on the call with you all today. So as what we've been seeing is somewhat consistent with the region. We did not see a large spike in numbers after Thanksgiving. We did have a little bit of a bump, and we're currently at 6 inpatients for COVID. We are kind of seeing more of a increase in our non-COVID patients, I think, coming in, hopefully some due to delayed care, again, not doing overly well. Our ICU census today, we have 6 ICU beds, and we do have 5 ICU patients so that are on that status. And last week we did go over our ICU capabilities. We had the staffing to do that last week. And that's mainly because we have been fortunate enough to be able to find some additional agency support, and we have brought in additionally 10 RNs, so that's about a 10% increase to our workforce, and that has really helped us with our staffing challenges over the last week or two. Right now, from a PPE perspective, we are doing okay. We actually have the Max Air units that we utilize. So we are able to, meet the needs of our staff from a PPE perspective and aren't really seeing big challenges there. I'm going to let Dr. Longwell speak to some of our transfer challenges and kind of some ways that we've mitigated some of the challenges we've had there. But I think right now it's really our focus, like you said, is on being mindful about what we're doing every day as far as preventative measures, and making sure our staff are staying mindful of those measures, wearing their masks. As we've rolled out vaccinations, we have 28% of our staff vaccinated. We did receive an additional 300 doses from Moderna this week. And so by the end of next week, we're hoping to see about 59% of our staff will be vaccinated. That's encouraging because again, part of our challenges have really been in keeping our own staff healthy and, from exposures outside of work. A lot of people on quarantine and when you're already a small hospital with the not very much capability to flex up and down easily, that really puts us in a bind when we have, even as few as 5 staff out. So transfer wise, we've been pretty fortunate here the last couple of weeks, and I'll let Dr. Longwell kind of speak to that.
Yeah, throughout the pandemic, we have been able to maintain that anyone who requires intubation for COVID has been able to be transferred out. We have obviously switched a lot of our protocols regarding intubation now that we know that that's not the preferred way to treat COVID. So we keep them a lot longer off the vent And then when they're really kind of at that last ditch effort, is when we're calling for transfers and intubating. We have 24-hour coverage in both our ED and our hospitalist program, which is also very beneficial to us, especially as a smaller hospital. And then we've recently started a partnership with a telemed company out of Wichita called Free State Health. And in addition to them helping us with some nighttime hospital support, they have a rural transfer line where anywhere that they are an attending at a hospital, they are able to help us move patients. So some facilities that would have never been on our radar before, like Rock Regional in Derby, have been some places that we've been able to get some of our non-COVID people to see some specialists that we don't have here, like infectious disease, but they may not need a COVID, so that we can save some of those COVID or those beds at other facilities like in Wichita and Topeka for more COVID patients. We also have a pretty robust post-acute care program. We have swing beds as well as a 10-bed, in theory 10-bed, COVID has changed all of that, rehab program. So we're bringing in some pretty sick post-acute care patients to our rehab program. We've rehabbed, I believe, close to 10 COVID patients in just our inpatient rehab. That does not include the patients we've done skilled care on. So we're seeing them on both the end before we transfer, and then those who are fortunate enough to do okay and need some post-acute care coming back to our skilled and rehab programs.
And we have reached out through the KU Collaborative and just, have done some marketing to let both Stormontville, KU, and some of those tertiary hospitals know that we do have the capability to take back those skilled patients and acute rehab patients to try to open beds on their end to help them out as well.
Thank you, Dr. Longwell. Thank you, Julia. They spoke about terms like swing bed and post-acute. So oftentimes those are the hospital care where someone has been to a place like Stormont Vale, St. Francis, KU Med, et cetera, and they need a little more additional care before they go home, before they're safe to go home or to go to home health. And that's where our smaller rural hospitals can be very helpful, is taking back patients, whether they're COVID related or non-COVID related, after they've had a hospitalization in a larger area. So we really appreciate the time and the information that you've shared with us from Emporia.
You're
Thank
welcome.
you.
Yep. Thank you, Julia. And thank you, Dr. Longwell, for all that you're doing. And Sarah, thanks for that translation. And I think it's important to understand too, as I've learned in this, that the transfer back down into the critical access hospitals and the rural hospitals is more of a unique thing to this pandemic era than what was the norm before. Is that correct? Yeah. And it's just part of how our health system has flexed and tried to adapt to expand what they can do and how they can care for people, and make the beds available for the sickest of the sick where there's the most tools, and a little different having to move people around. And that's why we have Dr. Watson here from Shine Mountain Software, a old Kansas physician who helped create the software that deals with patient transfers. And he has some analytics from this region. So Dr. Watson.
Say hi to my Newman regional friends. Good to see you all. And yeah, some updates. And I think we're actually in the middle of a refresh now. So you're going to see a different dashboard, I think, than you've seen before. Let me switch out here to this one and see. So what you're seeing is the dashboard we follow to assess transports across the state. And I think there's some things that I want to stress here. One is there is some easing and stability in the system. Certainly from the number of available beds, there's not a great change, but severity and the acuity of the patients that are moving seems to be slightly less. The COVID percentage is also slightly lower, so that we're seeing slightly fewer of the transports being COVID presumed or COVID positive. The length of time it takes to move a patient, the time from request to the time they're able to leave the hospital, Still, we're running in the 1 hour, 15 minutes time frame. If these people need to find a bed, though, we're seeing that go up to 3+ hours. And that sometimes in the system, we're waiting 3, 4, and 5 hours to have a bed open up. I will say in the last week, we've seen fewer critical days than we've seen in the past. We had several days over the holidays that were very, very tight with maximal capacity at every institution we were transferring to. And now with we've had a couple days that have been, I would say, easing, where we're able to move patients a little more frequently and with a little less time constraint. The number of requests are slightly down, but I think that it's representative of local capacity in the region being able to absorb more of their own patients than we've had in the past. And I think that's a good thing for the system overall. I think as we look at the bed availability across the state, we're still at the referral centers primarily at capacity or near capacity levels. So no time to ease up on what we're doing. We're all taking a breath, knowing that with 90 million Americans moving over the Christmas holiday, that the first 2 weeks in January could be something that we hope doesn't happen, but certainly the number of cases could climb dramatically. So everybody's getting a breath here just by the fact that we're not growing in severity and in volume, and in hopes that the first 2 weeks of January will be similar and that we'll see some easing as we get into the month.
Thank you, Dr. Watson. So before we wrap, any other color anybody would like to provide from the group after kind of hearing everything? Derek or Sarah, Julia, Dr. Longwell?
Sure. I would like to just, since we've been talking about transfers and the movement of patients, the healthcare system relies on the flow of patients to be healthy, essentially. So, when we talk about number of hospital beds available, that's dependent upon, skilled nursing facilities being able to accept patients that may need rehab or may need long-term care. It's reliant upon retirement communities having spots available and home health workers being available. The entire system as a whole is not just one component, and so when it's cliche, I think at this point, we say we're all in this together, but there's so many people, I mean, you just tell on this call here with different backgrounds and levels of expertise in their respective fields. And it really takes all of that together to make all of this work. And it's very, very complex, but we've got amazing people like all in these boxes that are really working our tails off to make this work as best we can. And so that's why we ask the public to do the things that we do, because without that, it becomes very, very difficult very quickly. And we don't want to go back to those numbers. So please be smart.
Thank you, Derek. A lot of head nods going on. And it's interesting, I'm a restaurant person and I've learned a lot about the healthcare system last month or so. And it is truly an ecosystem, and that has been working very well, exceptionally well, I'd say, through this, is that it needs to adjust, and it's the people that make it come alive. And so thank you all for being on here. And I couldn't tell, Julia or Dr. Longwell, did you guys have anything you wanted to add before? Okay. So I want to bring up a point, people out there try and take advantage of moments and such. We wanted to take, just as we think about vaccine, to put people on notice some of the scams that go on around that. So just 3 bullet points for you to remember, or maybe you to share with people in your life that you think may be susceptible to something like this. 1, hey, you will never be asked for money to enhance your ranking for vaccine eligibility. All right. So number 1, no one should be asking you for money to bump up in line. Number 2, government and state officials will not call you to obtain personal information in order to receive the vaccine. So do not give personal information over the phone when it comes to the vaccine. And 3rd, you will not be solicited door to door to receive the vaccine. All right. So 3 things to keep in mind. We have to bring it up because people do it and people fall for it. And so please help spread the word. You will never be asked for money to bump up online. Government state officials will not call and ask for personal information over the phone, and you won't be solicited door to door. We're also hearing from the Kansas Chamber of Commerce that across the state, and it's going on in other states, there's a lot of unemployment fraud also going on. So just to be aware of that, if you own a business or yourself, that people are trying to file fraudulently in unemployment. And if we get information on direction from the Department of Labor, we'll share that with you as well. But we like to end not with the dark spots, but with a bright spot. So a group of K-State students, and this is where we just try and catch people doing something right inside the region. A group of K-State students will be sidewalk chalking public health messages all over Aggieville, reminding students of the right public health behaviors needed to keep businesses open, schools in session, hospitals from being overrun. Kansas Leadership Center is doing a Stop the Spread, 1,000 meetings across the state, and just helping people think about things they can do to lean in. And a group of K-State students going out and chalking in Aggieville, help people remember as students come back in January or late January. So thank you for everybody for doing that. So this call every Tuesday at 2:00. This is the Northeast region, and you can sign up to get an email of it at covid.ks.gov/report-outs. So we want to wish everybody, I hope you've had a good holiday season, and we'll see you next year. So Happy New Year, and we'll be back, same bat channel, same bat time. Thank you all very much.
Thank you.